Question of the Week from the Naked Scientists.
Hello and welcome to Question of the Week. I'm Eva Higginbotham, and this week I've been scrubbing up to find the answer to this question from Carol.
The government has provided more than 1 billion items of PPE to hospitals. The government has provided more than 1 billion items of PPE to hospitals. There have been 130,000 COVID cases in hospitals, about 10,000 items of PPE per patient. Can you find out why so much?
Let me just pop my gloves on. Now, let's have a look at those numbers, shall we? Between the 25th of February and the 5th of July 2020, the government provided 2.2 billion items of PPE, or personal protective equipment, to the NHS. That's a big number for the 280,000-ish cases of coronavirus that we've had so far. So where is it all going? I put the question to medic Isabel Cochrane.
Let's start by considering the figure itself. This 2.2 billion comprises not only the more obvious items such as masks, aprons, gowns and individual gloves, but also includes behind-the-scenes provisions such as cleaning equipment, detergent, swabs and body bags.
So the definition that the government is using for PPE is broader than you might first think. But how do the numbers scale up to nearly 10,000 items per patient?
Let's do the maths. When seeing a patient, a member of staff would be expected to wear a minimum of gloves, an apron and a mask, so at least 4 items of PPE. Usually, a visor and a hat would also be needed, increasing this to 6 items per patient encounter. Although PPE can sometimes be reused, generally, between seeing patients, you would be expected to change at the very least your gloves and gown to minimise the possibility of transmission of infection. Add to this that medical teams are pack animals. A patient in A&E might expect to be seen by a couple of junior doctors, a consultant, 1 or 2 nurses, then accompanied by 2 porters to the radiographer who takes their chest x-ray. You get the idea.
The latest government guidelines also state that staff should wear PPE when seeing any patient, not just confirmed or suspected COVID cases. And there's also the tremendous work being done by the NHS outside of hospitals in community settings. The numbers really add up.
Finally, it might be worth asking how much PPE the NHS uses on a good day. The figure for PPE provision across the NHS in the year 2019 was around 2.4 billion. So, despite the pandemic, we're only using about 3 times as much PPE as normal, a comparison which can help put numbers with lots of zeros on the end into perspective.
So there you have it. Thanks, Isabel. Next week, we'll be getting into a lather over this question from Julie.
I'm wondering if there's any science around the wash, rinse, repeat method that manufacturers tell us is the best way to use their shampoos, or is it just a really clever way of getting us to use more? Thank you.
So, what do you think? You can email chris@thenakedscientist.com, find us on Facebook, tweet @nakedscientists, or join in the debate on the forum. That's at thenakedscientist.com/forum.